Well, thanks for coming back and joining me for another video. In my last video, I know I had asked, which was kind of short notice, what anybody would be maybe interested in seeing or hearing me talk about or whatever. Um, and I ended up asking some of my friends about it, what they would maybe want to see. One friend had brought up overall or in general coping mechanisms, what a coping mechanism is, um, what coping mechanisms maybe that I use personally and that I find effective, and how I came to those conclusions, um, which I really liked as a topic, and also the idea of talking about personality disorders as a very brief overview. Um, and I thought, well, personally, I don't even really know exactly what coping mechanisms I use. I know I do use some, but I don't even really know how I got to those points, and I never actually really thought about it until she had brought this up to me. So in the end, it's great because now I have some food for thought, and it made me think. Well, with personality disorder, you end up coping um, with the word that you'll find all over the internet if you look it up will be maladaptive, which you can look at as dysfunctional. Um, so I'm gonna swap the word maladaptive for dysfunctional for this video because even for me it's easier. So basically, what a personality disorder, um, it's a long-term mental disorder where your behavior, your cognition, or your thinking, and the way you think, the way you perceive the world, the way you perceive others, the way you perceive yourself is maladaptive or dysfunctional. Um, and it's pervasive, which means that it um, is extensive, and it gets into like every little crevice, every little bit of your life. Um, the ICD 10, the ICD manual is what I prefer, which is the International Classification for Diseases. So it has more than just psychological uh, and mental health issues labeled in it. It has, other ailments as well, but they do have guidelines just for personality disorders as a whole. Um, and it's like I said, it's long term and it's enduring. Um, it's the behavior of the patient or individual um, is definitely abnormal. Um, it's their behavior or just the way that they um, cope and interact with others is dysfunctional. Um, it begins and develops early on, during childhood or adolescence, during the time that you're, developing into a person, and it leads through into adulthood. Um, and the reason why it's considered a disorder is because it causes marked distress in a person's life, makes it almost, in some cases, almost impossible for the person to function. Um, they can have the person with that can have significant problems with social performance. It can basically make a person disabled and unable to work or go to school. Um, and these things, since it's a personality disorder and your personality is in itself inflexible and rigid, so is the disorder. Um, and it's diagnosed when, especially if there is, um, if there's like a possibility that there was head trauma or, say, medications that could be causing this abnormal behavior, you won't get the diagnosis right away. They will rule those types of things out. Um, and for example, I have a personality disorder. Um, I have gone through many diagnoses in my life. I was told at one point that I had borderline personality disorder, but I knew that that didn't fit because some of the criteria for that specific personality disorder, it just didn't fit. Um, and there are three clusters of personality disorders. There's different types of personality disorders. I believe there's 10 personality disorders that are listed, and then there are, I believe, another four, or there are more than four, but there are other personality disorders that were listed in previous editions of the DSM, the Diagnostic Statistical Manual, that no longer are listed as personality disorders, but it seems like sometimes certain personality disorders, it's almost like they come together. But the cluster A is called the eccentric cluster. Sometimes a lot of the time I see the word odd used, and I don't know why I don't like to use the word odd. Because odd, when I think of the word odd in my head and I think of synonyms, I think of words that might not be so positive. But eccentric to me is, or disorganized maybe, would, it just suits it better. And that's paranoid personality disorder, schizoid, schizotypal. Um, Sometimes people that end up getting diagnosed with schizophrenia or schizoaffective disorder, um, sometimes they'll have these diagnoses beforehand. Um, and it turns out that they actually have schizophrenia, but it wasn't just presenting exactly like it earlier on. Then there's the dramatic cluster, cluster B, which with PDNOS, that's sort of where I fall. I Mine being not specified, I don't have enough of the criteria for any one of the personality disorders in cluster B, but I have enough that I definitely have personality disorder that centers around the dramatic type of borderline personality disorder, also known as emotionally unstable personality disorder, and antisocial personality disorder, narcissistic personality disorder, and histrionic personality disorder, which histrionic personality disorder is basically a personality disorder where a person will do nearly anything to gain attention, whether positive or negative. And I know that a lot of times, from what I've what I've read personally, is that a lot of people with histrionic will use seduction to try to get this attention. The third cluster is called the anxious cluster, cluster C, which is avoidant, dependent, and obsessive compulsive personality disorder. So you can see that there are differences between them, and they all have their specific things that make them very difficult to cope with and to live with. And then the not specified section lists passive aggressive personality disorder, or self defeating personality disorder, which is also called the masochistic personality disorder, sadistic personality disorder, depressive personality disorder. I think it's like Haltlos personality disorder, and psychopathic personality disorder. But like I said, those are no longer listed as diagnoses in the DSM, but are rather listed as like subtypes or as um, characteristics of the others. Um, and an interesting fact about personality disorders is um, in 40 to 60% of psychiatric patients, 40 to 60% of psychiatric patients are diagnosed with a personality disorder of some sort. Um, so that makes them actually the most frequently diagnosed mental health issue out of any. Um, it's like I understand that this is in somebody that's already a psychiatric patient, but 40 to 60% is such a major percentage. Um, and something that I think is very good that's coming up with the new ICD 10, they always come out with new editions. Um, they are going to sort of get rid of all of these names and everything that I just went over and just put personality disorder. And I had to write it down. There will be specific specifiers called prominent personality traits, and the possibility to classify them in by the degree of severity of mild, moderate, and severe, um, based on the dysfunction in the person's life, and with their interpersonal relationships. Um, Personality disorders also tend to make a person um, impulsive and act on their emotions without thinking. Um, and especially with the cluster B, there's the impulse control problem. There is um, a lot of, um, especially with borderline, self injury, recklessness, and drug use. You'll see a lot of the time people with uh, cluster B personality disorders will also have eating disorders, will and have problems with depression and anxiety, um, and that's sort of what I've had to try to learn over the course of my life, alongside trying to learn other things for other disorders, which is, I guess, why I'm still not 100%, but uh, still trying at least. Um, I had to and have to continue to learn how to cope properly, and a coping mechanism is just something that you would do to alleviate or help the way you feel, especially when you feel negatively or you feel badly, whether it's anger or sadness. And I would say self injure or self harm to try to ease the way I was feeling or change the way I was feeling. And I had to learn that even though that coping mechanism worked, it was maladaptive and dysfunctional, and that I shouldn't be doing that, um, and had to find another way to release that sadness. So, or release that anger, whatever it happened to be. Um, and now I try to channel it into writing and drawing and creating more than creating less and being very self-destructive, um, as an example. Um, but I know I don't have a whole lot of time, uh, so if you have any questions, please leave it in the comments. If you haven't yet, please subscribe down below. And I hope you enjoyed my video. If you have any suggestions or anything, please let me know. Thanks for watching. Thanks for listening. be kind to yourself.